Hi, I'm Dr. Kenny Levine. Welcome to Health Talk. Health Talk is a show that's airing in South Florida, but it can be seen throughout the world at WEYW19.com. I myself am a dentist. I'm a periodontist. I treat gum and bone disease, laser therapy. We treat patients from 3 days old to 100 years young. But this is not a show about your mouth. It's not a show about your teeth. It's a show about total wellness from the top of your head down to the bottom of your feet. So in the show, I get to interview doctors and health professionals of all aspects of health and care. And tonight I'm here with Dr. Anthony Pannozzo. Tony, welcome.
Thank you.
Well, you know, people, I've heard your name different places. Tell us a little bit about your background. Where are you from and how did you get involved in what you're doing?
Well, I'm from Ohio, and I went through medical school, and I took a residency in physical medicine at Ohio State. I'm a Buckeye fan.
Okay.
And so after that, we worked out there in Ohio for 35 years.
Now, physical medicine, that's not a popular specialty like plastic surgery or dermatology or orthopedics. Yeah. Where do you fit in the specialty aspects of medicine?
Well, it's treating acute problems, pain problems, using exercise and other means.
Now, acute pain, does that mean, I know that for our viewers, it's not long-standing chronic dull aches. These are severe, sharp pains?
These are severe, sharp pains, but also chronic pain is only acute pain over time. So
okay.
The term chronic means time, not severity.
So, and if somebody would call you up and say, gee, I have a dull ache that I've had for 25 years, right. That's not a patient you would see?
I would see them.
You would see them?
Absolutely.
Okay. So, you were from Ohio. Where did you go?
Then we went to Phoenix for a while, and then I came here to Delray in 2006.
Okay.
And the only people who knew me at that time was my two brothers and my daughter.
Right.
That was it.
It's a very small practice.
Right.
You know, I had the same thing. When I opened up a practice, and I started in the 1970s, I had patients from all over the country. They were all relatives of mine. I had an uncle who flew over from St. Petersburg, and I had uncles that come from New York. Everybody wanted to be taken care of, and they were very nice. They had a lot of confidence in me. So you came here in 2006, but you were in Phoenix for a long time then?
Just a couple of years.
Uh-huh.
Most of the time was in Ohio.
Okay. And is it difficult to get the public to be aware, or do you get referrals from other doctors?
Well, it's kind of a different practice, and it's more based on the physiology of we call it physiology of pain production. In other words, how do you get a pain? And that's based on the failure of the normal physiology of weight bearing, which is a physics problem. So that's how we approach it for any joint or any spine problem.
So our viewers are not physicians; they're not doctors. Let's give them a Reader's Digest version of what you're talking about.
Yeah. Okay. Well, taking low back pain. There are so many parts in there. They all work together. But if one goes bad, if you fall, lift, twist, then there's some of them won't work together, so they become symptomatic. In other words, painful.
Right.
So all you have to do then is take a history, find out which side it's on, where does it refer to. That tells you where it's from. And then we do a special film. It's a patented film, by the way. I have a patent on it, a use patent, because you do X-rays too, but you can't patent X-ray. But the usage, and so then, which is better than a MRI, by the way. And so then we analyze that, offer the guy, or whoever it is, a shot or two, and knock that pain right out.
You know, I remember I was a young man. I was in dental school, and one day I was driving the car. I got a pain in the back, in my lower back. I thought somebody put a knife in my back. Mm-hmm. Fortunately for me, it went away within a day or so. But this is something that is recurring for people. Is it constant? Is it intermittent?
No, once we treat it, it doesn't come back.
No, I'm talking about the pain that would bring somebody to you.
Oh, it's just any pain. Pain is defined as being uncomfortable for someone. It ruins their lifestyle.
Okay.
If their lifestyle is affected by pain, then they should get it treated.
Okay. Now, in your many years of practice, how many patients come to you directly? How many are referred by other medical professionals?
Most of them come directly.
They come. Yeah. So how do they get to know about you?
Well, I don't know. Word of mouth, I guess.
By word of mouth.
Yeah.
How many patients have you treated with this situation over these years?
We're up to 65,000 plus.
Okay. We're going to go over each one of those 65,000 cases in just a moment. Dr. Kenny Levine with Health Talk. We'll see you in just a minute. Thank you.